While NABP is supportive of decreasing prescription drug costs for patients, we are committed to keeping the U.S. prescription drug supply chain safe through 3 distinct offerings. First, NABP is educating state and federal policymakers on the risk associated with prescription drug importation. Secondly, NABP is working with state and federal regulators and industry partners to develop tools that support implementation of the Drug Supply Chain Security Act. Thirdly, NABP provides expert guidance to the pharmacy industry and reliable support to state regulators.
One thing is for certain, COVID-19 has brought about challenges that we may never see again in our lifetime and has forever altered healthcare regulation and practice. However, during this life-altering event, we never missed a beat. Almost immediately, we launched the Emergency Passport Program as a tool to support states experiencing staffing shortages because of the pandemic. Other steps we took was to meet virtually with boards of pharmacy executive directors to collaborate on important public health issues. Then, we provided virtual pharmacy inspections so that we could continue to assist pharmacies despite regulations. We also continued our work toward improving workplace safety and well-being for pharmacists and technicians. And finally, we led discussions on permanently extending certain regulatory waivers to address patient needs during the COVID-19 pandemic. We will continue to work with regulators through this difficult time to protect public health.
Opioid use disorder continues to devastate our country. Roughly 21 to 29% of patients who are prescribed an opioid will misuse them, and between 8 and 12% will develop an opioid use disorder. Even more disturbingly, overdose deaths involving prescription opioids average about 41 people each day.
Well, the goal for MAT, or medication-assisted treatment, is to use medications for opioid use disorder in recovery for individuals to live a happy and healthy, self-directed life. Well, the biggest progress we've seen during the pandemic has been the use of telehealth in treating opioid use disorder. Clinicians can work with individuals remotely and send out orders to pharmacies. Health and Human Services are giving providers authority to prescribe medications for opioid use disorder for up to 30 individuals without the Data 2000 waiver. And speaking of the Data 2000 waiver, I'm proud to say that NABP worked with and has supported the MAD Act out of New York that was introduced by Congressman Paul Tonko. We found new and creative ways to provide MOU, or medication for opioid use disorder, to individuals, from collaborative practice agreements among providers and pharmacists to now mobile medication-assisted treatment projects. Even though we've done a lot, we still got a lot to do, and I think as regulators, we need to ensure that any regulatory barriers restricting pharmacists to work collaboratively with providers to provide access to MOU are removed.
Everybody from different states has different experiences, and this is a great opportunity to get together and hear what everyone is experiencing in their own state and collaborate together to make an improvement.
We want to have professions really feed into what we do and guide our profession in general. So you have different people from different backgrounds within the profession of pharmacy can bring their unique perspectives into that.
And once I came to that first board member meeting, I met people from around the country that were doing the same thing that I was doing. And it just broadened your horizon on the amount of people that you meet.
The interaction and the networking is the most crucial thing of all the things that we do with the interactive forums. You can only do so much through the virtual format, but actually being in person with the individuals and having that conversations that need to be had, I think is the absolutely most crucial thing that we can do.
Throughout my years of serving as an NABP Executive Committee officer and member, I've seen colleagues come together and collaborate for the benefit of protecting patient safety. Especially in these difficult times, our success illustrates something I've always known to be true, that NABP and its member boards perform, develop, and innovate at their best when faced with crises. While my sincerest hope is that this upcoming year brings you joy and healing to all of you, I know that we'll come together, no matter what, to continue advocating for the important issues and furthering NABP's mission to protect the public health.